TikTok, TikTok live. You live?
Mm-hmm.
So, good afternoon and welcome to our TikTok viewers and our YouTube live viewers. So today we've got a couple of lives going on. This first one is all about sports massage and how it can help prevent injuries. We've got a patient on the bed who is a fitness coach, so she's doing fitness classes at David Lloyd, and I think you also do swim teaching, don't you? So she's constantly on her feet, obviously she's constantly exercising, in and out of classes, no chance of actually cooling down or warming up, I guess. So she's with our osteopath Sam. Hi Sam.
Hello.
So can you talk us through what you're doing and why you're doing this on Sophie particularly?
Yeah, so I've seen Sophie quite a few times in the past anyway, but she's always got quite a tight upper back. She's quite flat backed, which just means there's a little bit less suspension going on in her back, which is just the way her morphology is. And I'm working on the muscles either side, the erector spinae muscles particularly, as they're feeling rather tight. They're quite deep, them ones, so you have got the layers of the trapezius and rotator cuffs as well. But you can feel the structure all the way down, so it's probably the muscles that are the...
So why is she suffering with that? I guess it's all part of her job, is it?
Yeah, part of her job. She's quite tall as well, so because of the flat back, they're she's using their muscles as a suspension, no doubt. But yeah, where she's quite physical, she's always on the go. She's going to have quite a lot of tightness going through her body. She's quite what's the word? She's got quite a lot of muscle structure on her as well, so that helps as well with the toning.
So what sort of treatment does she normally have then on a sort of weekly or bi-weekly?
We work on anything from her neck to her shoulders really. They're the main areas. I'm just doing a general on her back today just to give her a little bit of loosening up.
And why is sports massage so important then for people that are gym goers or like Sophie, a coach and obviously does work in the gym?
Because when you have a massage, it breaks down the adhesions within the muscles, which then gives your muscle the full capacity to lengthen and shorten, which will then in turn give you
So welcome if you've joined us on YouTube Live. It's the first time that we've actually been doing both lives at the same time. If you've joined us on TikTok, welcome. Slightly different this first live today because we're showcasing what our osteopath does. So you're with us every Monday in London, and then the rest of the week you're in Essex, aren't you?
Yes.
So what other areas can you treat with sports massage to stop injuries occurring?
Well, any area really, the whole body really, as long as there's a muscle group there, you can work on it. So especially with shoulders are a main area, lower back, glutes, neck, legs.
Yeah.
Sometimes we sort of cluster the areas together as to just sort of make it into a treatment plan.
And one of these things I heard you talking about with another patient earlier is referred pain. What does that actually mean then? So
a good example of referred pain is the supraspinalis muscle, which is one of the rotator cuff muscles. It abducts your arm.
Mm-hmm.
So when you get pain, or when there's a tendinopathy there, you'll actually feel it in your arm down here.
Right.
That's because the attachment point is down here, and that's what sends off the signal of the pain, rather than actually coming from the belly of the muscle, which is on the back here.
So someone could come with you with a bad arm,
Yeah.
but actually it's...
But once I do my tests on them to see what movements is it that hurts them, I can then determine which muscle is actually the problem.
Oh, right.
But yeah, you can get referred pain, or the other way you can get referred pain is through nerves. So if there's a trapped nerve, you'll get referred pain on that nerve line.
Brilliant. If you've got any questions for Sam, either on YouTube Live or on TikTok, then please send them over and we'll answer the question. So with referred pain, is there any particular part of the body that has more of it, or can it be anywhere?
It can be anywhere. You tend to get more referred pain if you've got, say, a trapped nerve within the spine. If you've got it in, like, say, the mid-back, you might get referred pain round the sides on your ribs. If you've got referred pain coming down the arm, it's either coming from your shoulder or your neck. And then if you've got pains like sciatic nerve pain going down the leg, it's usually coming from the back, or it could be entrapped in the glute as well.
Now, when we were live earlier, we were talking about BBLs, and we've got a really good example of someone that hasn't had a BBL and worked at the gym. So, do you want to just bring us back to that live and talk to us about what she would have done in the gym to get her glutes like that?
Well, I'm assuming Soph probably does quite a lot of leg work, things like deadlifts, bridges, what's the other one?
Squats.
Squats, that's it.
Yeah.
Using like the leg machines, they work quite well as
Yeah.
well.
Yeah.
Look, she could be doing hip training, lots of jumping, jump squats, things like that as well.
So before we carry on with that conversation, we've just got a question. Hi, Chrissy. So the pain is on my shoulder. What muscle needs to be worked on?
It depends on where in the shoulder. So you've got your rotator cuff, which is here. So there's 4 muscles. There's one here, one here, one here, and then there's one underneath as well. So depending on what way your arm hurts, whether it's that way, bring behind the back, bring in front of you, that will then tell me which muscle it is.
Oh, okay. So Chrissy, if you can, or Cassie, if you can answer that question. So going back to our live this morning, whilst we've got a super example of a good glute here, we were talking earlier about why BBL should be banned. So where's that sciatica nerve run from? To and from?
So it runs from, so if you find the end of the rib cage, there it
Okay,
is.
Cassie K says it's the top of her neck that hurts.
Top of the neck, it might be, if it's when she shrugs the shoulders, it could be the levator scapula, which joins from here and then comes into the shoulder here, so it's the shoulder shrugger. That's quite a culprit for a lot of things, especially if it's into the neck as well. Or it could be the trapezius muscle, which comes, it's like a big diamond shape. It comes from the base of the neck to the shoulders and down to T7.
Oh, hi Lisa. Yes, you did. That's Lisa who just spoke to us, Bina. Bina's with me as well. There's Nurse Bina. She's working YouTube today for us. Right, so where are we? So where's the sciatica nerve?
So you can find the rib cage. There's around the DLJ, L1. So you've got L1, 2, 3. From L3 to L5, this bit, that's where the sciatic nerve comes out. So it comes out either side, and it will come down through the glute, come through here, then it bifurcates here into the peroneal nerve and the tibial nerve and comes round into the foot.
Wow, okay. So obviously I know what it's for, but to help people that don't understand what a sciatica nerve does, what does it do?
It innervates into the back of the glutes, part of the hamstrings, and into the calf and the front of the leg and the foot.
And why do so many people have pain with it?
I think it's the biggest nerve in the body. So at its thickest point, which I'm assuming is probably around where it's here, it's as thick as your thumb, which then it can get trapped, and then it runs through. There's a muscle here called the piriformis. So if we bring Sophie's leg up and move her leg like that, that contracts and relaxes that muscle.
Okay.
And the sciatic nerve runs through it, weaves through it. Some people genetically weaves through it twice, and they're so much more susceptible to sciatic symptoms. But generally, it's either because these ones, the joints here, end up taking all the load because our core muscles aren't strong enough, and it gets caught. Or it gets caught through the bum muscles because we're always on our feet.
On our feet. Now, in fact, I had a personal experience with my sciatica. So I was suffering with really bad pain, which I thought was my calf or my hamstrings, but it was my sciatica nerve. So that's not deferred pain. That's something different, isn't it? Because that's running through there.
Yeah, you can just get sciatica where you can just feel it in the calf. It just depends on whereabouts it's firing up. But sciatica itself is actually a symptom, it's not a diagnosis. So when people say I've got sciatica, the sciatica is getting caused from something. So it could be getting caused from a disc protrusion of the spine, it could be getting caused from a facet irritation of the spine, it could be caused from piriformis syndrome. It can be a number of things why that's being caught.
Right, okay. And what's the treatment?
Treatment depends on what the cause is. So if it's a disc protrusion, and they don't need surgery. I'll do lots of traction around that area, loosen off the glutes, because whenever you get any sort of nerve pain, your muscles around that nerve will tighten up, and it turns into a vicious circle, because then if they tighten up, the nerve pinches more, which causes more pain, which causes the muscles to tighten up more, and carries on going. So I'd loosen up the area around there and around the back. If it's facet irritation, generally it just needs some manipulation, and that'll unlock it. If it's piriformis syndrome, work a lot on the piriformis and the glute area as well. And if they've got the sciatica down the leg, it generally will harden the leg, so I'll strip through the leg as well.
Wow, wow. How's it going on live? So welcome to YouTube Live if you've joined us. We've been doing TikTok Live for a number of years, but we've just started YouTube now. So welcome to all our new YouTube followers. So going back to Sophie's problem then. So as a sports coach, she's suffering with upper back. You do lots of weights, do you?
I do. I should do more.
You should do more. And I suppose her problem's going to be the fact she can't warm up or cool down.
Yeah, she's running around from class to class. She's probably not giving herself a stretch at the end and before she moves on to the next one. So that's what you do find a lot with sports coaches and things.
Okay. What have you found today on that?
She's tighter through her right side than her left, especially as we come down into the thoracic region down here. Generally her shoulders are quite tight anyway, especially around her shoulder girdle here into the teres minor. And
so Cassie Kay said the top of her neck was hurting, so have you answered that one?
No, we said if that's where the shoulders come from, it might be the levator scapular muscle.
So thinking about Nurse Bina, because she's here she is, there's Nurse Bina, looking well as always. What problems does she have doing the job that she does?
Nurses, anything like that, tend to have quite tight neck and shoulders because they're usually over patients. There's also that twisting as they're leaning over patients, so it could be a lower back issue going on as well. But generally with nurses I'd work all through the spine and into the neck because they are doing that. Sometimes when you get to, you concentrate, you start punching as well, getting involved. So yeah, a nurse will need a lot of neck and shoulders, but also I would be looking at their lower back as well.
And of course in a traditional hospital they're also sometimes picking patients up,
oh my god, in theatres you're literally moving them, or lifting as well, it's so bad.
Yeah, and it's interesting, and I suppose we're still learning. So osteopathy, whatever it's called. I can't say that word.
Because you're putting about three of them together.
Oh Lord. Anyway, that word. Did the NHS do it?
Well, osteopaths. Yeah, they have about, I think NHS might have about 10%, 5% of osteopaths in it, but they treat it a bit like a conveyor belt, so they might only give, I don't know exactly how much they give, but I'm guessing they give about 20 to 30 minutes a session. You can do a session in 30 minutes, but if you're doing a full case history, a new one, that's a bit tight to actually give any treatment.
Whereas your consultations, what, 45 minutes?
15 for a new patient, and then follow-ups are just 40 minutes.
Right, okay. So if you've just joined us, welcome to 65 Beauty. We're actually on the medical side right now because we're with our osteopath in London, and what we've got on the couch today is a patient who is a fitness coach, so she goes in and out of classes all day, and then when she's not doing that she's a swimming coach, so it's perfectly on there. How many times a month do you see her, Sam?
I was seeing you about once a month, at one point.
About that.
Yeah, then we all went on holiday.
Yeah.
So typically, is that average for someone doing that type of profession, or a big gym goer should see an osteopath once a month?
If there's no actual problems, you'll be blessed with having maybe a session once a month just to keep everything at bay.
Yeah. And what's the difference between, say, a sports massage that you would do and what a sports massage therapist would do? I don't mean just qualifications. I mean, is there a difference in qualifications?
I can't help but do some articulation. So where I'm rocking her now, I'm actually articulating the spine as well. So I know that I'm just off of the transverse process of the spine. So I don't know if sports massage therapists just give a general massage or not, but I'm very focused on, I know what muscle group I'm working on, I know what striate it's going towards.
So you might do more than massage in that session.
Sometimes. Yeah.
And then tell us, because I know a lot of people when we've gone live before have come and said, what's the difference between an osteopath and a chiropractor?
Yeah. So as far as I'm aware with chiropractors, they look at realigning your spine, whereas an osteopath will look at realigning your body. So by that I mean if you had a problem with your wrist and you went to a chiropractor, as far as I'm aware, they will crack your neck because that's the nerve root that governs the wrist. I would look at the neck, I would look at the shoulder, I'd also look at the wrist itself, and I'd work through the chain of command of what's going on. So I don't know where the actual problem's coming from, whether it is the wrist or the neck or somewhere in between.
Yeah.
So
Okay.
it just depends.
So what advice do you give to gym goers about how they can, apart from doing sessions like this with an osteopath, how else can they protect their backs when they're in the gym?
A good warm up and a good cool down. The amount of people I see, and I get it, once you get into it, you just want to get in and get as much of your workout done before you go to work. But I cannot stress how beneficial it is to have a warm up, because you're less likely to ping or feel like pull. And then when you do your cool down as well, you do a stretch, it will just make life a lot easier for you when you go back to the gym the next time.
Yeah, hi Joe, good to see you back on live. Yeah, I think the thing is, people see the warm up and the cool down as not part of their exercise, but it is, because when you're stretching your back or your legs or whatever you're stretching, then you're working those muscle groups anyway, aren't you?
I would never consider going into the weight section without first doing at least a jog on the treadmill to warm through my whole body and get my heart rate up.
And is that a good warm up then? A jog on a
Just to get
treadmill.
everything moving, to get everything warm. You're then working through your spine as you're twisting. And then if I go downstairs and I still feel my legs are tight before I start doing my deadlifts and my squats, I'll start just doing a little stretch, like forward, do a few things there as well. But I want my body to be warm, because my muscles will stretch an extra 20% once they're warm.
Right, interesting.
And that will give you a better lift of whatever it is you're doing.
So 20% more when they're warm
it's
than when they're not.
Out bed in the morning, you go, oh my god, I'm so stiff. And then by the time you walk around, your muscles are warming up.
Well, some of us have other reasons why they get out of bed stiff. But right, so...
You'll chat to that in a minute.
Oh, you opened that door. I couldn't help but jump through it. So while we're talking about weights and back, as we've got a super back example here, what areas do people cause trouble by not deadlifting correctly?
This section, this lovely section here, from the DLJ, well, just through the lumbar region, which is there, basically. If they don't engage their core and they don't keep their back straight and engage their glutes and their hammies, this bit is a bit that suffers.
So obviously I'm leading you because I understand it myself, because we both are strength and conditioning coaches. So what you're saying is that the glutes and the hamstrings need to take all of the pressure rather than the lower back.
Yeah, and also the core.
The core. Yeah. And why do people get it so wrong, do you think?
They're either not taught the correct posture, they're not mindful of their posture when they're doing it. Ego kicks in and just think, oh, I better lift a bit more, or my back's hurting but I've not finished my set and I want to finish my set because other people are looking at me, or they think people are looking at me, but they're not.
And of course, it doesn't necessarily need to be in the gym. You could be working in Amazon in the warehouse, lifting the box, and it's the same principle, isn't it? So going back to the nurses, then, were you taught as a nurse to lift people in different ways?
We would get manual handling training, which they would teach us how to lift patients, if we're lifting anything using a hoist. Because it's all about the back, and one wrong movement of not bending your knees, or for example, that can cause a lot of damage.
I see so many patients where they go, I know my manual handling, it was just one box I lifted at work where I overreached, I overstretched and tried to grab it, or I twisted and their back just went.
Yeah.
And I get a lot of patients like that.
Fantastic, Sam. So we're almost at the end, but we've still got time for some questions. So honestly, don't be shy. If you've got any questions on YouTube or on TikTok Live, then just drop them down and we'll ask Sam. You do consultations in London and Essex, don't you? So every day apart from Sunday?
Yes, some Saturdays, depending on what my social schedule's doing off.
what percentage of work do you do where you're fixing a problem rather than doing something like this where you're not fixing a problem, you're preventing a problem?
I would say fixing is probably, I'd say about 65-70% of my work.
So
And then people, I do try and get people to incorporate this in. Some do,
yeah.
some just go, oh, I'll come back with I'll
So
play
3 out of 10 people are doing it wrong,
Yeah.
almost.
It's much better as you're better off being proactive rather than reactive.
Yeah.
It's very similar to the messages that we give for Botox nurse, isn't it? About you don't wait for all the lines to come back because then you just build more muscle and you should do that.
Yeah.
So yeah, I'm all for preventative. So how's that feeling, patient?
That's a first.
So what other areas, what other prones do we see up here? Because I can see a neck, so that's going to be one, isn't it, that is going to often cause people stress.
Well, normally I'd have in a face hole, but the room next door was being used, so we can't get the face hole out. So we've improvised. But yeah, neck can sometimes be a problem, especially if people are looking up a lot or like hunching down, the shoulders round. As we come down here, you can see that side slightly more built up, that side.
Why is that?
And it's probably, you right-handed?
Yeah.
Yeah. So you just see it's a little bit more on that side there.
So one of the things that we see quite a lot, both me and Nurse Bina, is where people have headaches, but actually it turns out to be the neck,
Yeah.
or we end up Botoxing this muscle.
Yeah.
So I know that you're not into Botoxing because you're an osteopath, but can you explain, if you know, and I'm not sure if you do, but if you don't, then just let us know. But when we Botox here, you know, what are we doing? We're stopping the signals coming to the brain.
Yeah, so we've got this big muscle here. It comes from the suboccipitals, comes onto the clavicle, and comes down here. It's a big diamond shape. You've got the trapezius. Then underneath the trapezius, you've got the levator scapula, which I was telling you about, and it's just underneath. So there's the trap. If I pull the trap back, the levator scapula is just underneath, and that connects to the first 4 vertebrae in the neck. Now, if they're tight, that is going to pull on the neck and behind the head, and that's then going to pull the fascia. So generally, headaches arising from the neck come up the neck and they come round to the side of the head. Or you'll get occipital neuralgia, which is a painful line going over the head, which is the nerve, the occipital nerve, which gets caught. But they're generally the patterns that you'll get from headaches arising from the neck.
So when Nurse Bina's doing the Botox, you're stopping the signal from there through to the brain, are you? Or relaxing the muscle?
Yeah, you're relaxing the muscle to stop the fascia pulling on the head, and then stop it pulling, and it's causing that tension through the head, which then causes a headache.
And while we're on the subject, Nurse, of course, this is another good example of how the fascia, that is normally just the front, runs all the way over the back of the head and down, doesn't it?
It's like being, if your body is wrapped in a bit of cling film, and then we grab it and pull it, that's going to pull all around the head. It's exactly how our connective tissue works. What you missed.
Oh, Nurse Jolanda's made an opinion. Hello, Nurse Jolanda. What are you doing?
I've done thread lifting.
And we're going to be demonstrating thread lifting in a minute, aren't we? So if you are not sure about thread lifting, we're going to be going live in about 10 minutes, 5 minutes.
On Sam.
Nah.
You get it on Sam, mate. I'll pay you £1,000. Yeah.
You'd have that to watch, guys. I'm telling you.
There is no way Sam's going to let you put a thread in her face. So if you are interested in threads, then we're literally going to finish this live, and then we're going to go straight into threads. And in fact, Nurse Bina has agreed to be the patient today. Are you looking forward to being the patient?
A bit nervous, but
I bet you are. I bet you are. So it's like a mechanic getting another mechanic to do his work, eh? So we're going to wrap up here with Sam. Sam, thank you so much for letting us barge into your clinic, because I know we didn't ask.
Didn't ask something, but
There
there is consent, guys.
No, really joking. So thank you for that, and we'll get this posted on our timeline, and I guess you can put it on your website as well, can't you, as a good example of what can be done. And have you solved her problem?
She had a problem today.
No,
No,
I
she's
never have
nice.
any problems now because I see Sam.
Yeah, brilliant. And if you found us on YouTube for the first time, welcome to the party. We're going to be doing threads in literally 5-10 minutes. So if you ever wondered what threads were, then this is the place to be. So we're going to be back live in just a few minutes. And if you've got any questions on threads and you want to tell me now or send the questions now, then if you just message us and then we can ask the questions whilst it's being doing. So it's been a real pleasure, Sam. Thank you so much.
Thank you.
How do people get in touch with you? Through 65 Medical?
65 Medical, yeah, mainly that really.
Yeah.
I have got a TikTok channel, but I can't remember what it's called. It's Osteo.
But 65 Medical, that's where you'll be.
Yeah, I'm on there. That's
All
fine.
good. Thank you so much.
Loved ball.
One new follower. What did you